I, Mahi, on behalf of entire Civil Engineering Student Club, appreciate your precious presence in the seminar. The COVID-19 pandemic has led to dramatic loss of human life worldwide, presents an unpredictable challenge to public health, food systems, and the world of work. The economic and social disruption caused by the pandemic is devastating. Tens of millions of people are at risk of falling into extreme poverty. Even we students sitting alone and missing our college life. There are lots of questions arising in our minds. What is COVID? Why is it affecting our life in such an adverse way? How to save us from this scariest pandemic? In fact, some of us started thinking we will never live a normal life. With each and every passing year, our hopes and dreams are fading away just like an old piece of cloth. While on one hand, people across India and around the globe are largely confined to their homes with business and educational institutions all shut down in an attempt to contain the virus, and on other hand, doctors, healthcare workers, and medical staff members are leading the battle against COVID-19 from the front, putting their own life at the risk with selfless determination for the sake of saving lives. They truly our heroes in this challenging times. Therefore, to answer all your questions and again for lighting the candle of hopes and aspirations, I would like to call one of the frontline Corona warrior, Dr. 𝐂𝐶 ISR, who has done MBBS from Rangaraya Medical College. His expertise in his field with having 40 years of experience. So please, sir, share your valuable insight on what exactly is COVID.
COVID is one type of virus actually, which now there are different opinions about how it has been made or how it has come to the field now. But I think we have crossed 2 years of the same problem now. So let's forget about what exactly is COVID now. Okay.
Yes.
So
yes,
for
sir.
the last 2 years, we are living with it. So knowing exactly what virus, what type of virus it is, and what is the problems, with this, that these are things, we should know now. Okay.
Okay, thank you, sir. Now I would like to ask, will there be more variants after Omicron?
No, I don't think so. As it is, actually, I think if you don't mind, I'll take out my mask. Actually.
Okay,
I'm feeling
sir.
really suffocated. Yeah. Right? Yeah.
Yes.
According to our colleagues, our system now, I think, Omicron is the one, this is the last or rather the least virus, of the group of COVID. So after this, yes, we are going to live with it. It is like almost like, every year, we are going to see like typhoid, malaria, dengue, and we are going to see COVID also.
Thank you, sir. It is really happy for us. This news is really good for us even.
Yeah.
Sir, now I want to ask that do you think the vaccines we have now work against the new variants that may come in future?
Actually, there is nothing like a total vaccine, for any disease. It is always, if the variant is coming, now actually they say Omicron, and honestly speaking, we haven't seen much of Omicron, in at least in southern states actually. Omicron is there, on the paper only. We haven't seen Omicron, totally like last COVID, we had regular COVID last year, total COVID only. So Omicron is a version. I personally feel, this is what you call a weaker version of the COVID actually.
Yes, sir. So, what is the importance of vaccination against COVID? Because
Definitely,
many people are caring about vaccination.
No, actually, everybody should take vaccination. That is the main reason. India is, now, we are more safer, than most of the Western countries. We have taken many of the people, many of the people, all over India, actually. Let us say, we are 140 crore people, So we are completed, almost, first dose we are completed, and at least half of the people, they are completed the second dose. That is actually what exactly is saving us now. Compared to Western countries, like states Russia, even part of the Europe and all, they are having so many deaths there because they haven't taken the vaccine, or they have neglected taking the first dose, forgetting the second dose like that.
Yes, sir. So I think that it is very important for each and everyone to take both the doses for be safe and healthy. Sir, I want to ask, what is your opinion about the future of our world is headed towards considering these pandemics? That how we will going to face it and what is the consequences?
No, we take it as it comes.
Okay, sir. I think we are ready now.
Yeah, anyway, this is a big disaster, we are faced, we are almost surviving with it, I think, we can take anything.
Yes, sir. Sir, I want to ask, being a doctor, what do you suggest to students to keep themselves healthy physically as well as mentally in this tough time?
Only thing is, don't think much about COVID. So what I always tell my patients, whenever somebody is positive, with COVID, usually I'll be telling them, you have to stop so many things. First is stop seeing newspapers. Don't read newspapers. Stop seeing news in the TV. Come out of your WhatsApp groups and don't discuss this thing, with your neighbor. First, these 4 things are going to help you more.
Okay, sir. Sir, I also want to ask that how you feel when you have to leave your family when the whole world is confined in their homes and you work at such place where lots of patients are coming with such COVID cases.
This is part of the life, actually. It is what you call, these are the perks, you get with your job.
Yes, sir. We really appreciate your work and always thank that doctors are just really God for us.
No, don't say God, actually. Nobody is God here. There is only one God, actually. And we are doing our job here. Many of my colleagues also, they do the job only. And as far as possible, we try to save people here, right?
Yes, sir. Sir, now anybody from the audience want to ask any question from the sir, just write your query in the chat box. Sir would love to answer that.
Okay, sir. So the first question is by Aditya Raj. What are the consequences of high CRP?
No, actually, CRP is actually C-reactive protein is actually, it always affects, whenever there is an infection in the body. Only thing is, CRP came into prominence, only because of COVID now. But unfortunately, CRP is there earlier also. If you have common cold and if you have time and money, you can get your CRP done when you have common cold also. Your CRP is going to rise. It is always, associated with your infection. Toothache, eye infection, boil on the body, or even jugular fever, cold, cough, anything is going to increase your CRP.
Okay, sir. And sir, so the second question is by Pratik Vibhuti. Why do some people get COVID positive second time?
No, actually, there are 2 things here. First, let us take it more lightly, saying, it can be wrong. It is always a false positive second time. You are taking the proper care. And again, we have seen people getting it, second time also. Okay. So actually, the latent period, rather the period actually we want to control, or actually to get a negative is always fluid only. It's not like actually it's a fixed thing like 7 days, after 7 days you are supposed to get it. No. Nowadays, actually, with this third wave, we are seeing people getting it, positive even after 3 weeks, 4 weeks also.
Okay, sir.
Yeah. Only thing is they are not infectious, not that much. It takes time. The titer values will go down, slowly.
Okay, sir. Thank you, sir. And so the next question is again by Aditya Raj. What are the post-COVID complications and how to take precautions of these complications?
See, actually, the post-COVID complications, there's nothing like a set pattern here, Suppose somebody is having more, let us say, more headaches, after COVID. So usually, because what you should understand, as a professional, in your field also, what you should understand is, this disease is new. It is not written in the book earlier. I'm very sure, next year or day after next year, next after year, it may be a chapter in the medical book. Till now, it is just hearsay only. There is nothing like a set guidelines here. Okay. So actually, it is always, it is what you call connected, with the problem, the patient is having. Suppose, I have COVID. I'm treated with COVID. Then, after 15 days or 20 days, I started getting headache, every day. Then, my ophthalmologist says, your eyes are normal. My physician says, I'm normal. Then still I get the headache. Then, we are going to label it COVID, post complications of COVID is headache also. I think you are getting what I'm saying.
Okay, sir. Yes, sir. So, sir, so the headache would not be recovered. Means we will have to.
It will go. No. What I'm saying is there is no fixed thing. Like it is written in the book. It's not there. Okay. It is always what you tell the doctor.
Okay.
Suppose the patient is saying let us say a patient says post COVID after 15-20 days I'm having indigestion and loose motion. So loose motions are not controlled. Then patient himself thinks actually yeah, most probably this is the complication of COVID. The digestive system is affected. He may say that. That's what I'm saying. There is no set pattern here. Absolutely no.
Okay, sir. So the next question is by Subi Kumari. What is the new COVID Wuhan variant? It is in the news these days.
No. One thing I can tell you, the amount of publicity they are given for Omicron, I always say, with due respect to my colleagues and not colleagues, I'm sorry, to the newspapers and media, it is hyped up actually. So we don't have much time to write about anything. So we take something, blow it up. So let it come, Wuhan. Let them produce another thing and throw it us. Let us see. Why do you worry about that? Present thing is, the Omicron is the present thing.
Okay, yes, sir. Sir, so what do you think? Will it be?
भूत आएगा करके क्यों सोचना है यार अभी? भूत आएगा तो निपट लेते हम लोग.
Yes, sir.
You are from Bihar.
Yes, sir. We all from Bihar, sir. NIT Patna.
Yeah. I have a good news for you. I studied there for 4.5 years in Bihar, Patna.
Oh, sir. Good to know, sir.
Yeah, I studied in Patna Medical College.
Okay,
then I shifted to Andhra.
Oh, yes, sir.
So you are basically from Patna?
No, sir. We have people from all over the country. Just we are studying in Patna. Yes.
Okay, so exactly, right.
It's good to know, sir, that you yourself are studying in Patna, sir.
Yes, sir. Yes. It's almost my hometown there, actually. I still have some friends there in Patna.
Good to know, sir. So the next question is, sir, Vivek Singh is asking, sir, what is your suggestion on when to open the colleges and educational institutions? Since the lockdown, they are not open. So when should
sorry. Yeah.
Sir, when should the educational institutions be opened in the country?
I am not the one to decide it here. I also feel, children are missing their college studies, students, not going to school and enjoying the time there, spending time with the friends. And I also feel it, but I am not the deciding man.
No, sir. So we want to ask, sir, as a medical professional, what do you suggest? Will it be, will it spread COVID-19 much faster when we go to the colleges and schools or not?
No, actually, now actually after Omicron, I personally feel, the main idea of Omicron, or the gods and blessings with Omicron is, this is going to give everybody, what you call, that herd immunity, now. Again, 140 crore people, most of the people are vaccinated once or twice. And at least, let us say 1/10 of the people are already affected with it. So herd immunity is going to set in actually. Now it sets in, I think, they can go. But once in a while, one patient will be coming up, one student will be coming with Omicron or COVID. But I think, we have to take it in the stride.
Okay, sir. So is it safe to say that we have entered the herd immunity now?
I think so.
Okay, sir. And sir, Pratik Vibhuti is asking how to boost our immunity against COVID-19 while staying at home.
Only thing is eat healthy food. Take your do your exercises properly. Eat healthy food and avoid crowds. And then stay fit.
Okay, sir. And sir, one question everyone has in mind, that if we wear proper masking and do sanitation all the while, will it be safe to come out of the house and roam wherever we want if we take the necessary precautions?
No, as long as it's not necessary, don't roam around.
And and the next question is by Aditya Raj. Can a person who recently had bypass surgery take booster dose?
Definitely, yes.
Okay, so okay, sir. And how many days isolation is sufficient for person arrived from another place?
Beg your pardon?
Sir, for how many days should a person be in isolation after coming from another place? Means the
No,
isolation
it
period.
depends. No, actually, it depends upon the state to state, country to country.
Okay, sir. No, sir, as a medical professional, what is the period that you would suggest? Like 7 days, 4 days, or what?
Now, actually, the government is saying 7 days, I personally feel it should be 10 days.
10 days. 10 days would be fine.
Definitely, yes.
Thank you, sir. And sir, I would like to know, sir, what was your experience with COVID-19 as a medical professional working in the field?
What does that mean?
Sir, what was your experience with patients in the COVID time? How the time went for you? Means the
No, actually, it is always a busy time only. But I always tell everybody, whenever somebody is affected with COVID, I tell my patients who are affected with COVID, who are cured with COVID is, don't get scared with COVID.
Yes, sir.
COVID is like any other flu. And only thing is, it is unknown flu. Only that is the only reason. So, jo darega, you complete the sentence.
Yes, sir. Everyone have understood. Okay.
So you take it actually. There is nothing to get scared about it. Only thing is, if you are positive, okay, see a doctor. Now, actually, this Omicron is a very lighter version, It doesn't need, many times, many patients earlier times, they are needing 𝒚𝒂𝒆 or what you call other things, This is a lighter version. You can just take it like a flu drug, And just take rest, take healthy food. I think, it's all right.
So you said that we have entered herd immunity, and we can take the Omicron variant to be the general flu. Okay, but again in the news we are still seeing that many people are dying due to COVID-19. So what might be the reason?
Maybe though many of the people who died actually may not have taken the vaccines.
Okay.
And second thing, general condition, they may be very weak. Third, as somebody said, from there was an interview, earlier, from Delhi, AMS, actually one doctor who was treated in the last wave, 2,500 inpatient cases. He said, most of the deaths, are rather 10 to 15% of the deaths in COVID are all due to fear.
Okay.
That's what I said. Jo darega.
Yes. Thank you, sir. And sir, next question is there. Is there a hike in blood sugar level after the intake steroids? Common. Means if there is a hike in blood sugar level after the intake of steroids?
Yes.
Okay. Okay, sir. So all the questions done. Now over to you, Mahi. You can ask your last question.
Now, sir has already answered all the questions very properly, and we have get all the knowledge regarding the COVID pandemic. And I must say that thank you so much, sir, for clearing all our doubts and for sharing such valuable insight about COVID pandemic and the precautions required. Now it is our duty to implement all the changes in our day-to-day life for keeping ourselves fit and healthy. We should always remember that healthy minds reside in a healthy body. And sir also said that precautions are better than cure. So make yourself more, take precautions and be healthy. Now I would like to call Nripendra Gupta sir, Vice Chairperson of CESC Club, for vote of thanks.
Okay, so again a very good evening everyone. Hope you all are doing well. So first of all, Dr. Krishna Swami sir, it's a pleasure to have you here. Sir, you tackled all our queries and doubts about COVID-19 so well, and you explained it all so properly, sir. So we are very thankful to you that you took out time from your busy schedule to adorn our event and raise awareness about the COVID-19. Thank you so much, sir. And
yeah. I want to add one more thing here.
Yes, sir.
So whatever things I told or explained are actually my own opinions, I'm not contradicting my earlier colleagues, or I'm not contradicting those who are presiding me. Okay. These are exclusively my ideas, what I implement in my clinic. When I see my patient, these are the things I always tell them. So it may be correct or wrong, but I am implementing them. Okay. All the best to you. Thank you. Have a wonderful time.
Thank you, sir. Thank you, sir. And thank you, everyone, for your precious presence here. And you can leave the meeting now.
Thank you,
Thank
sir.
you, everyone. Thank you, sir.